98.7 The Bay, the Seacoast Soft Rock Station. Natasha Bedingfield and Unwritten. 7:39 now. About 50 degrees, much cooler today. Clouds, some breaks of sun. 54 at the coast, 58 inland. And we welcome into Seacoast in the morning Dr. Warren Goldblatt. He is from Eyesight. And welcome to Seacoast in the morning, Dr. Goldblatt.
Oh, thank you very much for having me.
Great to hope I didn't get you up too early this morning.
No, this is nothing.
Little tougher today because it's not 80 degrees out, but what are you going to do? It's springtime in New England. First of all, tell us a little bit about yourself and tell us about Eyesight and where you guys are located.
Well, I work for Eyesight Ophthalmic Services. We've been a practice on the Seacoast for over 30 years. Mm-hmm. We have offices in Portsmouth, Exeter, and we just recently combined our Dover and Rochester offices in Somersworth up on Route 108, just north of the Works.
Right, just above the Works. Yeah, everybody knows where that is. Yeah. Nice spot. So tell us about a little bit about what you specialize in as far as eyes and seeing.
Well, like most of us at Eyesight, I'm a comprehensive ophthalmologist. I see children, I see adults, I do pretty much a mixture of everything. I sort of specialize at this point in refractive cataract surgery, which is not just cataract surgery per se, but using special implants and special devices to try to minimize people's use of glasses after surgery.
I'll tell you what, you and I were talking off the air. As everybody knows by now, I've had cataract surgery. I had it years ago, but it has come so far. It's just unbelievable.
It is really unbelievable. It's almost like magic.
Yeah, it really is. I remember after getting mine, it was like, well, there's leaves on the trees. That sign says stop. Stuff I couldn't see before. But now it's even better than that because you're talking about the lenses that you put in now. I was told, well, you can see near or far. I chose far so I could just wear the reading glasses. But now you've got it right down to you don't even need those, huh?
Well, we can
depending on the patient, right?
Depending on the patient, we can minimize or perhaps in some patients eliminate the need for glasses for anything. There are some small percentage of patients who may need glasses for certain tasks, maybe reading very fine print,
yes,
or if it's dark, or maybe just seeing intermediate. But it's usually you can usually get distance and intermediate or distance and near very well with these special lenses now.
All right. Also talking about this time of the year is allergy season. And I bet you get a lot of people coming in going, my eyes, they're either dried out, they're watery, or they're red. Or so what do we do with those?
Well, it's not just patients; it's me included. Typically, when the trees are in bloom, so am I.
Yeah.
Well, the symptoms of allergic conjunctivitis would be typically foreign body sensation, like you have a piece of sand in your eye.
Yeah.
You may have watering. You may have redness, and then typically the quintessential symptom for allergic conjunctivitis would be itching. So if people have mild symptoms like watering or foreign body sensation, usually we recommend just an over-the-counter artificial tear.
Okay.
There's many brands out there. The Systane products, the Refresh products, they're all very good.
Okay.
And then if those are not effective, then we go to the antihistamines. There are antihistamines that are available over the counter. Zaditor and Elistat are two very good ones over the counter. And there are prescription drops which are even more effective. And then sort of the gold standard, if you will, if you have terrible conjunctivitis that the antihistamines don't work for, then we use topical eye drop steroids.
Mm-hmm. And that seems to do the trick. That's the
the
go-to one where it's like and I noticed you call it conjunctivitis. Is that not to be confused with the conjunctivitis you get when you're like a kid?
Well, to be technical, conjunctivitis really is a generic term. We have the layer of tissue that sits over the white part of your eye called the conjunctiva, which is normally clear,
right,
but has blood vessels in it. So when it gets inflamed, that's an itis, conjunctivitis,
gotcha.
Appendicitis, laryngitis. Itis means inflammation. So conjunctivitis can be separated into allergic. It can be chemical. You go swimming in a very heavily chlorinated pool, you'll get chemical conjunctivitis. And then there's the infection conjunctivitis, which would be bacterial or viral.
Okay, right. And it's all the same stuff. It's all the same part of the eye.
Correct.
All right. Also, we were talking a little bit about glaucoma this morning, Dr. Goldblatt. What exactly is glaucoma? And how do you even tell that you've got symptoms or whatever?
Well, that's the problem with glaucoma is there are no symptoms. It's really like the silent thief of sight. Glaucoma probably is a family of diseases that have many things in common. Typically, we look at high pressure. You can have an abnormal appearance to your optic nerve, and then eventually with long-standing glaucoma, you'll have a loss of peripheral vision first that gradually creeps in on you to get like keyhole vision.
Oh, I see. Yeah.
Fortunately, that's just very severe glaucoma. And again, unfortunately, you can't tell unless you get an eye exam. You're never going to know. There's plenty of people I've seen like, wow, you've got awful glaucoma. They had no idea.
No idea. So the key is go see your eye doctor and have them check it out, because if there's no symptoms, you're not going to know sometimes until it's too late, huh?
Correct.
Yeah. So you need what do you suggest? How often should I go see the eye doctor?
Well, typically, I think every eye doctor has their own sort of series of how often people should get seen. Typically, children who wear eyeglasses, I recommend they get seen once a year.
Okay,
period.
right.
I mean, I have 3 boys. 2 of them wear glasses, and every 9 months I'm changing their glasses, their contact lenses, because as they grow, their prescription changes.
It's just like you got to buy them new sneakers.
Exactly. And then when they stop growing, then we can relax a little bit.
Yeah.
Contact lens patients, we also recommend get seen at least once a year. But in my opinion, for adults who just wear glasses, I recommend every few years or so, figuring you will know when it's time to come in because you need new glasses when you're not seeing as well.
Right.
For adults who have no medical issues with their eyes, like, for example, diabetes, which can affect your eyes,
right?
Or if they just have an early cataract, I recommend every few years, 2 to 3. But if you've got things that are going on, then obviously once a year. And if you have any eye disease like glaucoma or macular degeneration,
that's another one I was going to ask you about.
Much more frequently.
All right. Well, in fact, we'll ask you about that more coming up in just a little bit. 7:46 right now. Let's get some Kelly Clarkson. 98.7 The Bay, the Seacoast Soft Rock Station. That's Kelly Clarkson, and since you've been gone, 7:49 now, 48 degrees. A much cooler one today. Clouds, some breaks of sun, too. 54 at the coast to 58 inland. We are talking with Dr. Warren Goldblatt. He is from Eyesight. And, Doctor, again, your locations here on the Seacoast?
We have locations in Exeter, New Hampshire, Portsmouth, and our newest one in Somersworth, New Hampshire.
All right. And what are your hours?
Typically, we're 8 to 5 every day. We are open in various offices some evenings as well.
Okay, and also, let's see. You have a website.
Yeah,
of course.
That's eyesightnh.com.
Okay, and you've been around the Seacoast for a long time. Been doing this for a long time.
Right. I've been here just about 20 years, and the practice has been in existence for over 30.
Okay, and so and you're accepting new patients, of course.
Always
accepting new patients. So we were just talking about we touched on the cataract surgery. It's just come so far in a very little a period of time. I remember my grandfather when he had cataract surgery, he was walking around with that patch on his eye for like 3 days or whatever, and they finally take it off and that kind of. But it's nothing like that anymore.
Oh, it's nothing like that. I mean, cataract surgery in the late 80s became fantastic when we went to small incision cataract surgery. Nowadays, most of us can do cataract surgery really in less than 15 minutes from the time we start to the time we finish.
Unbelievable.
Usually, we're sending people home with just a pair of glasses. We don't patch the eye shut at night.
Right.
We don't patch the eye shut when we're done, although they do wear a shield over their eye when they sleep for a week. So if they roll over, they don't press the eyeball for that first week.
Exactly. That, and we talked about allergies. You get some good allergy remedies. If somebody's got it real bad, you can really help them out.
Yes, like I said, we can use topical antihistamine eye drops, or in the worst cases, we use topical steroid eye drops.
And, of course, we talked about glaucoma. Please get your eyes checked. That's about the only way you're going to really figure that one out, isn't
Absolutely.
it?
Otherwise, you'll never know.
Yeah, until it's too late.
Well,
until it really
potentially,
starts,
yes.
You start losing vision. Yeah.
Well, the thing is, you never know. It's like watching your kids grow. You really can't see them grow, but if you take a look and picture what they looked like a year ago, like, wow, I can't believe how different they are. So glaucoma is really the same way. You lose your peripheral vision so slowly, you don't notice it.
Yeah. All right. So, again, your locations?
Somersworth, New Hampshire, Portsmouth, and Exeter.
All right. Very good. Dr. Goldblatt, thanks for coming in and talking to us this morning.
Thank you very much for having me.
All right. 7:51 at Seacoast in the Morning.
Hi, I'm J.C. Hayes from